Okay, good morning, everyone. Good morning. Thank you. All right, thank you so much, DJ, for that wonderful background music and everything. And good morning, everyone. Good morning. You're all welcome to Clarity Health 2025. Who is excited? Please, we are excited. Let me get some reactions from you. End preventable medical errors by making healthcare communication clear, inclusive, and understood by all. Thank you so much, everyone, for being here. I believe that we all came here with one expectation or the other. And as most of us know, I will be hosting this program. And my name is Gladys Ninyio, a supervisor for the Smart Creators team. And I will not be doing this alone. Yes, forget my name is there on the poster and all, but I won't be doing this alone. I'll be doing this with a very smart, intelligent, I don't even know, and a very great lady by the name Aisha, and she will come in to introduce herself. Aisha, can you please do that? You're welcome.
Thank you very much, Miss Gladys. All thanks be to God Almighty for sparing our lives to witness this day when we are live on this conference of Clarity Health 2025, organized and hosted by Otondo Team Limited. I pray we have a smooth and successful conference that was meant to benefit us all. I'm Aisha Mohammed Waziri, the team leader of Smart Creators called interns of DSHub. I'll be your co-host for this conference. I welcome you all. Thank you for your time, and I hope we all have an educative, informative, and interactive section throughout. Thank you very much.
Thank you so much, Aisha. Thank you so much for that beautiful introduction. You see, I told you, and you guys could actually see for yourself. Thank you so much, Aisha, for being here. And like she said, we welcome each and every one of you to this conference. And being here today, we also have special guests in our midst. We have special guests that will be speaking to us on different topics. And we are going to introduce them right now. We will do that taking turns by turns. And we have our first speaker for this conference, which is Dr. Ahmad Aladi. And Dr. Ahmad Aladi is an accomplished obstetrician and a gynecologist with 6 years of extensive experience in the emergency pediatric unit at Yobe State University Teaching Hospital. And he will be speaking to us on the topic improving pediatric emergency responses in maternal care. You are welcome, sir. You're welcome, doctor. It's a pleasure having you here. I don't know if he's here. If you are here, can you just indicate? Please, let's celebrate him. Let's celebrate him, please. And we have our second speaker is actually supposed to be Nurse Aisha, but Nurse Aisha is not here. She's unavoidably absent. So we'll just skip that. We are going to skip that introduction. And we have our third speaker who is going to be the second speaker in person of Barrister Aisha Tahir. And she's a dedicated legal advisor at DSHub, renowned for her sharp legal insight. She has a strong background in regulatory compliance and intellectual property law. Barrister Aisha will be speaking to us on the topic understanding the rights and risks in healthcare delivery. It's a pleasure having you here, ma'am. If you are here, can you just indicate by raising your hand? You're welcome. Let's celebrate her. Yes, and our fourth speaker, who is going to be the third speaker now. Okay, our fourth speaker will also not be available. Is in person of Dr. Ada Gabriel. He will be unavoidably absent also, so no need to do that introduction. And the fifth speaker who is going to be our speaker is Mr. Abdurrahman Abdurrahim, and he's a product designer here at DS Hub. He is also a tech adventurer and fronted explorer, and he will be speaking to us on the topic how design enhances clarity and safety in healthcare tools. You are welcome, sir. It's nice having you here with us. Thank you so much. Let's celebrate him once again.
Okay, thank you for that. On our list also, we have Mr. Lawal Abdurrahman Adewale. He's the product manager at DSHub. He's an information marketer, a digital marketer, and a public speaker. And his talk is going to be on building digital products that prioritize clarity in healthcare. We also have Mr. Etieno Abasi Oduse, a dedicated law student at Bauchi State University and tech enthusiast. As Ocha's top-up representative, he merges legal knowledge with technology to promote ethical digital services and empower communities. And he's going to discuss on how law and technology can make health services better for everyone. I'm sorry I skipped to uh, welcome Mr. Lawal Abdurrahman Adiwali. Please, if you are present, you can indicate, and let's welcome him with some reactions. Thank you very much for being here at the conference. Mr. Etiono Abasi too, please, if you are present, you can raise up your hand. Thank you very much for your reactions. Next, we have Ms. Sharifat, who is a dynamic public health advocate and a digital enthusiast also with a background in microbiology and public health. She bridges health and digital spaces through data coordination, social media strategy, and product management. She'll be talking on how social media can be used to teach people about health and help our communities. Please, ma, if you are here, you can raise up your hand by indicating. And we need to also celebrate her and welcome her. We are really honored to host you all here as our guest speakers. And the last on our list, and the last not the least, is Miss Mariam Ibrahim Hamza, a passionate data professional and a advocate with a biochemistry degree from Kaduna State University. She leverages data science to advocate public health education, digital literacy, and inclusive digital training. So her topic for discussion is going to be on the use of data to make health better and fair for everyone. That's a very nice topic, and we look forward to hearing from all our speakers. Ma, if you're here, you can raise up your hand to indicate, and let's all celebrate her. Thank you very much. We are really happy and honored to host all our speakers. Thank you very much. You are all welcome.
Okay, thank you so much, Aisha. Thank you so much for that wonderful introduction. Also, thank you so much, and thank you so much to all our speakers. So the next on our list is the welcome address by the CEO and the founder of DSHub in person of Mr. Muhammad Adam Shamsuddin. Please, can we celebrate him? Can we celebrate him, please, as he comes up? Let's celebrate him. It's not easy. Seriously, it's not easy for someone to come up with the vision of having this great establishment. It's not easy. Let's celebrate him. You're welcome, sir.
All right. Thank you very much, Gladys, for this insightful welcome. And I want to thank your host, Aisha Waziri, for putting in this introduction at the beginning of this program. So thank you very much, all. Like Gladys mentioned, my name is Mohammed Shamsuddin, and I am the founder and CEO of DSHub. So basically, I am the face behind everything that happens at DSHub. And I'm so happy today to see you all here present in this an important event, an important milestone. And I want to ensure, tell you that this program is going to be an insightful program, and you will not regret being in this program. It's because it is about improving lives. It is about empowerment. It is about so many things in between healthcare. So thank you very much all for joining. Thank you very much all for joining. I'm very grateful to see you all in this program. So Thank you very much, all. I'm going to go ahead with giving you an overview of DSHub. Please kindly indicate if you can all hear me. Can you please kindly indicate if you can all hear me loud and clear? All right, thank you. So basically, what is because I realize that there are so many people here who don't know much about DSHub. Yeah, probably you might be seeing DSHub online somewhere while you are on your timeline, right? But you are maybe probably wondering what is DSHub. So DSHub, basically DSHub is an organization. It is a research and development organization. What we mean by research and development organization, DSHub uh, assess academic works, right? Then we transform them into an impactful real world solution that can solve the problems in our society, right? That can address so many challenges in between the healthcare. And why we are doing that is because we want to support the federal government initiative, right, in what are facilitating the development of intelligent solutions that address critical societal problems in our societies. And that's why we at DSO we merge research, development, and business all together because we are for-profit organization. So we want to what, solve a problem, improve lives, at the same time make money. Yes. So that's everything you need to know about DSHub. We are a research and development organization. Anything we work at DSHub, any product, any initiative, any empowerment program we work on at DSHub, it is purely based on research and development. Research is backed by everything we do at DSHub. Even our own staff go through rigorous research methodologies, yes, to deliver a solution. So that's basically about DSHub. At DSHub, we concentrate on three things. I mentioned them, but I want to mention them again. We concentrate on what are building technological solutions that solve problems in the healthcare sector, and also we what create initiatives, right? We what initiatives in a way of maybe giving awareness, right? Healthcare awareness to people in communities. We'll be able to reduce some challenges faced in the primary healthcare sectors, secondary healthcare sectors, including the tertiary healthcare sectors. And also, we have an empowerment program. Empowerment program, we what support the federal government initiatives in what in empowering youth, right? Giving youth skills, soft skills, right? Giving them so many various skills to be able to support the development of intelligent solutions within the healthcare sector because we are focusing on healthcare sector. So we want to because we realize that in order to solve a problem like that, we need to what be we need to serve as a pioneer in what building a workforce that can actually bring our vision to life, and that's what we have been doing at DSHub. Um, our internship program, DSHub internship program, is one of our empowerment programs, and I'm so happy to share with you guys that today is the day of the graduation of our interns. We call them Otondo interns. Yeah, so today is the day of their graduation. So we match their graduation with this initiative, which is Clarity Healthcare 2025. So we match both the graduation and the initiative we are pushing out, which is a national call to action. Clarity Health 2025. I want to thank you all again for joining this initiative. This is very, I'm so happy. Why I'm so happy? Because it shows that there are many people who share the same interest with DSO. Anybody that is here share the same interest with our organization DSO. We all have the same interest, right? That's why we are all here. We want to solve a problem. We want to what, address so many problems that happens in our societies. So I want to just go to give you some glimpse about the interns that we are graduating today. We started uh, in the last 9 weeks. We are on the final week today, which is the day of their graduation, and we have started over 9 weeks ago. And how we started, we actually we received over 100 applications. Out of 100 applications, we shortlisted about 30 applications, And out of these 30 applications, I think only few of them get to this milestone because so many of them were withdrawn, some withdrawn voluntarily, while some were disqualified, because the program we have is very, very intensive. Yes, it's very, very intensive because we want to streamline the work process, the real work process, right, in the DSHub internship program. So every intern will be what? Equipped and is ready to work in any organization in Nigeria or even abroad where they want to work. And also DSHub give them an opportunity, right, to work to get a job placement. Yes. And speaking of job placements, out of these interns that make it to the end of this internship program, we have hired about five of them. Five of them are now working with us at DSO. This is to tell you that we are what? We mean what we say by what? Supporting the workforce, building a workforce, and also what? Supporting the workforce and what? Giving them an opportunity, job opportunity as well. And so I want you all to understand that we have a structure, and this structure is actually what it's built to what benefits the youth, and also what to make impact, and also what to provide a solution that will address so many problems in our societies. So I think I want to go back to the healthcare. Sorry, I've been taking so much time, but I want to go back to the healthcare initiative theme, which is healing begins with clarity and the future of what safer healthcare. They are going to speak. We have experts from diverse backgrounds. These speakers, some of them are our staff, while some they are not our staff. We invited them to come and speak. So please, I want you to make use of this opportunity this time to learn so much. Of course, I realize that there are many students in this call, and there are many people from other organizations who decided to join. I'm so happy because we are all sharing the same interest, and I'm happy to say that we are definitely going to learn a lot from this program because I am going to learn. Sure, you are going to learn. One way or the other, we are going to learn so much about this. We are going to learn something very, very important and to be able to know the way forward and how we can be able to reduce these issues that are facing our society. So thank you very much all. I think I'm going to stop here. Again, thank you so much, Gladys, for giving me time and opportunity to speak. Thank you all.
Thank you very much for that wonderful presentation. I would really need to appreciate him. This is a selfless, visionary man who is concerned about the well being and the safety of our lives towards healthcare. So you have the zeal, you have the mission, or you are thinking of how you are going to impact towards our societal development toward in health the healthcare sector, you really need to come and join us here at DSHub. Give your own contribution, learn, and also learn from you, and then we all work together in impacting towards good health, clarity health care in our society. Thank you very much, sir, for creating this opportunity for a lot of people, and you're touching a lot of lives. Thank you very much. And next in our agenda is presentation by the Cohort A interns. We're going to start with the first theme, which is content creation, and the presentation is going to be made by Rabiatu Ali Muhammad. You have the floor now. Rabiatu, we are all listening to. Let's welcome her and appreciate her.
Good morning, everyone, and thank you so much for being here today. It's a privilege to be part of this important conversation. Let me share my screen. Please, can you see my screen?
Yes, we can see it. Go ahead.
Okay. My name is Rabiat Muhammad Aliyu, and I am honored to represent my team to share our thoughts on an issue that is urgent and deeply human. It is about medical errors and how we can best prevent them. rural clinic once suffered from language fluently, and there was no interpreter. You see, a small misunderstanding led to a wrong diagnosis and a preventable harm. According to WHO, that is World Health Organization, 1 in 10 patients globally suffer harm during hospital care, with up to 50% of these incidents preventable. Healing begins with clarity in communication, systems, and shared responsibilities. Now, medical errors go beyond incorrect prescriptions or surgical mistakes. They are often fueled by gaps in miscommunication within healthcare teams, language barriers between patients and providers, especially in multilingual regions, limited access to accurate patient data, inadequate training on new technologies or protocols. In Nigeria and even across Africa, these issues are worsened by high patient volumes and lack of resources. But we can use three approaches to stand out and bridge the gap: empowering healthcare personnel through training in patient safety practices and encouraging open communication among teams. The second approach is leveraging technology, from electronic health records to AI-based decision support tools. Technology reduces the risk of human errors. And most importantly, inclusive language technology like the innovation of DSHub. Imagine a nurse in a rural area consulting with a patient in Hausa, while an app instantly translates her instructions into Yoruba or English for a colleague. Or even a doctor using voice to text tools that record patients' data in their native language but present it in English for consistency. That is what DS Hub is making possible, allowing clear communications and reducing the risk of errors. We have fostering collaborations between healthcare systems, policymakers, and technology innovators like DSHub. So tools are tailored to local realities and actually used on the ground. The role of DSHub includes inclusive language tools for healthcare, voice to text, and real time translations, bridging gaps in patient understanding and reducing errors from miscommunication. Healing begins with clarity, and clarity means clarity in communication between teams, clarity in patient provider conversations, and clarity in shared responsibility across all sectors. And as a new generation of healthcare professionals and technology and also innovators, I believe with the right tools and mindsets, we can bridge the gap. I leave you with these words from Dr. Lucian Leap, where he said, the single greatest impediment to error prevention is that we punish people for making mistakes. Together, we can bridge the gap for safer healthcare. Thank you.
That is very wonderful. Let's appreciate Rabi. Actually, she really tried. That's a very impressive, summarize a brief, insightful presentation about Clarity Healthcare. Next, we have data science theme, and the presenter is going to be Mr. Faith. Mr. Faith, if you're available, you have the floor now.
Yeah, good morning, everyone. It's nice to be here, and I welcome you guys all to the Clarity Health Conference. Can you see my screen?
Yes, you can see your
Okay.
screen, sir.
Clarity Health Conference 2025. I welcome you once again to the Clarity Health Conference. I want to start by stating a fact, and the fact is that 3% of death cases in Nigeria is actually caused by the medical practitioners. And we're not just saying this without fact. We're saying this based on the statistics and based on what WHO has aligned. According to WHO 2023, around 1 in every 10 patients is harmed annually. And this harm is also very, very preventable. And that is why DSHub came with a mission to leverage insight on identify and analyze and reduce the root cause of healthcare errors across Nigeria. And our vision is to create a safer and more equitable healthcare system in Nigeria by harnessing this data to eliminate and prevent these medical errors. Now we can see from our introduction, you can see a picture of medical practitioner trying to like perform uh, a test on a patient, and this is aimed at cutting or reducing sickness predicted. Now, there's serious intervention needed in this healthcare sector. Why? Because 50% of the harm that occurs annually is actually preventable, and half of this harm is attributed to wrong prescription and medication. So there's a need for us to understand what this patient safety means. There's a need for us to understand how these medical errors can actually be prevented. And that is why DSO align with the Sustainable Development Goal to make sure that this issue of health errors is looked into. At DSHub, we advocate for patient safety. At DSHub, we advocate for eradication of medical errors. At DSHub, we advocate for a better healthcare future. And that is what we do.
Mr. Faith, you're not taking us through your slides. Sorry for cutting you in.
Okay.
Your slides, your
Wait,
screen actually.
can you
Please
see my
check
screen
what
now?
you're sharing. I can see it, but you have not opened any document.
Can you see my screen?
Yes, I can see your screen, but the slides are not. You have no. You're not going. You're not taking us through any document written.
Are you serious? Sorry about
Yes.
that.
All right.
Sorry. I'm sorry about that. I'm coming. Can you see it now?
Yes.
Okay. All right. Thank you very much. Um, what's wrong? Wait, you can go on with the next people. I will probably I will just come back, right? I don't know.
Okay.
Yeah.
Sorry for that.
Yeah.
Next is the graphic design team. If you are ready, you can present now. Let's welcome them.
So, good morning, everyone. My name is Yasir Bello Jangebi from Graphic Team. So, I would like to welcome each and everyone present here with us. So, before I proceed, let me share my screen. Are you seeing my screen?
Not
Hello?
yet. Hello, we can't see it.
Okay. All right.
Mr. Faith, please can you mute your mic?
Mr. Faith, please can you
Mr.
mute your
Faith.
mic?
Oh.
Mr. Faith. Oh.
So, can you see my screen now?
Yes, I can see it.
Hello?
Yes,
All
I
right.
can see it.
So as we gather today to explore a solution that bridge the gap in healthcare and reduce medical errors, we are also proud to split a unique force driving this movement behind the scene, the DSHub interns. These are passionate young minds from across Nigeria who have dedicated their time, skills, and creativity to projects like Clarity Health 2025, designing, coding, analyzing, and collaborating all with one goal to make healthcare smarter, clearer, and faster. What you are about to see is more than just a slide. It is a glimpse into the vibrant journey of DSHub internship experience, where learning meets impact and where tomorrow's tech leaders are being shaped today. These interns are proof that when we invest in people, we plant the seed of clarity and information. We present you the faces of these innovations, the DSHub Cohort A in terms of 2025. So let's watch this short showcase of the interns.
Waiting be this one like this. Been through many things, many gist. I still find my peace in all. Oh, you are see me, I know they see. I say I know the year. Which kind person be this? Waiting be this like this. Been through many things. I ain't Genesis. I be dealing with enemies. Survivor, new leader, money chaser, faster than the bullet, flying like a rocket. Bad man will never rest. King of South and US, faster than the car. Move ever myself, faster than the bell. So, you let me so. Bad vibes on the ground.
So that is it. With this, uh, I wish all of us all the best. Thank you.
Thank you very
Thank
much.
you very
Let's
much.
appreciate
Let's appreciate.
Yasif from graphic design. Mr. Faith, are you ready? Mr. Faith. Okay, let's move on to the next item on our agenda, which Miss Gladys is going to take us through our speakers. Thank you very much.
All right. Thank you so much, Aisha. And thank you so much to the cohort A interns. Thank you so much. Thanks so much for your professionalism and your clarity in the presentation. Thank you so much. Faith, once you are ready, just let me know so that we can let you in so that you can make your presentation. So now we are going straight to the presentation of the speakers. And our first presenter is Dr. Ahmad. Dr. Ahmad will come in first. So before Dr. Ahmad comes in, please let me just make this announcement. Make sure you have your pen, your jotter close by, so that in case you have any question, you just write it down. And then, okay, sorry, please write down your questions in the income message. You see that part. Just any question you have, just type it there. Then the speakers will actually see the question. Any of the speakers, just tag the person and then write out the question there. In case the speaker does not see it, I will call the person's attention to it, then so that they can actually respond, so that we'll be fast about it. Thank you so much. Yes, Dr. Ahmed, you're welcome, sir. You can go ahead. Sorry, Dr. Ahmed, are you here? Dr. Ahmed, can you hear me? Can you just okay, just 1 minute. Let me speak to him. David, can we just have a background music before then for just 2 minutes?
Hello, can you see my screen now?
Not yet, Mr. Faith.
What about now?
Yes, I can see your screen. Please go ahead.
Okay. All right. Thank you very much. Once again, I'm so sorry for that. As I started earlier, you can see executive summary, right? Can you see executive summary on the screen?
Yes.
All right. All right. Thank you
Yes,
very
we
much.
can.
So I'm very sorry for earlier. Like there was issues with network and also some logistics. All right. So basically, I welcome you guys, everybody, to Clarity Health Conference 2025. And the theme is healing begins with clarity. With clarity, the future of a safer health care. Now, this work delivers a compelling exploration into the critical issues of medical errors in Nigeria. We know that it's very alarming for us to depend on the medical practitioners and for them to eventually fail us. And that is why we are looking into what is this medical error? How can we prevent it? How can we minimize it to the minimum? Over 3 million preventable deaths occurs annually due to unsafe care. And this is a statistics by the WHO, the World Health Organization. And how can we now factor ourselves? How can we factor ourselves as an organization to prevent 3 million deaths? Imagine 3 million out of 140 million. That's a whole lot. How can we prevent these medical errors in the healthcare system? So our mission is to leverage these data-driven insights to analyze, to identify, and to reduce the causes of all these errors in Nigeria. The moment we can identify the problem, then we can find solutions to this problem. And DSHub had a vision of aligning itself or aligning ourselves with sustainable development goals to actually eradicate this menace in the society, this medical health error. Now we can see the picture of a medical practitioner trying to perform some tests on his patient, and that is what we at DSO is actually agitating for. How can we reduce this error? How can we prevent these 3 million deaths? How can we look for ways to enhance the health sector in Nigeria? Patient safety. Patient safety in the health error context is the absence of preventable harm to a patient, preventing these harms that we can actually like prevent. How can we save a patient? How can we ensure that uh, someone who is sick gets the proper treatment to enhance his well-being? And that is what we are actually advocating for. We are advocating for patient safety at DSHub. We are also advocating for eradication of medical error at DSHub. Now look at this case study. This is a medical practitioner calling the name of another patient. He says, "You'll be very happy to know that we have new procedures that will prevent mistakes, Mrs. Brown." And the patient responded that my name is Mrs. Smith. Now we can see that this is a typical example of error in the medical sector. Now imagine Mrs. Brown is having typhoid and Mrs. Smith is actually having probably Mrs. Brown is having typhoid and Mrs. Smith is suffering from probably stroke. Now, this is a typical example because the medical practitioner is actually thinking that Mrs. Brown, the medications that Mrs. Brown will get if it is for treatment of typhoid will definitely be different from that he has assumed to give Mrs. Smith. So this is a typical example of error in file handling due to improper database or due to non-professionalism or to low or poor work ethics. So this is one type of error that we at DSHub are advocating for, that we should eradicate this, we should reduce this to the minimum. Now we can see our data sets that we used for this exploration are not just dummy data sets. They're data sets that we got from different reputable websites, such as the Ministry of Health, from newspapers, where cases of medical errors across states was also recorded. We also saw cases from the northern state, cases from the western state, cases from the eastern state, and these are all data sets that are that are liable to be used, because before we can use any data set, we have to make sure the data set is genuine. We have to make sure the originality of data sets can be proved, and that is why we embedded the pictures of data set here. Now we also went ahead to look into all these figures that we got from those websites, and we came up with a strategy. We came up with a simple analysis on this thing. We came up with areas that need serious attention. We came up with areas that is doing well in terms of this healthcare sector. We came up with areas that needs urgent attention, and those are some of the recommendations that we're going to give. And Aisha will also speak in respect of this data that we have, in respect of the dashboard. Aisha, you can go on.
Good morning, everyone. I'm Aisha Amza, data science intern from the DSHub. So I'll be walking us through the dashboard. The dashboard offers a rich multi-dimensional view of healthcare error and access issues across different states and demographics. As you can see at the top, we have 4 KPIs, which immediately draws our attention to key figures like 24 cases of language barrier, 42 cases of misdiagnosis, 17 policy failure, and 20 surgical errors. These headline metrics set the stage for deeper insights throughout the visuals. In the first image, we have gender distribution, and that is a donut chart. A donut chart that shows that fairly or but slightly more female representation, suggesting that women might either face more errors or they are more often included in the data. And we also have the age distribution donors chart, which also shows that which break down errors by ages, and this reveals which age groups are most impacted. Also, moving forward, we have error rank by states, which is an horizontal bar chart. We can see that from the bar chart, we can see that Borno has the highest error incidence, closely followed by Sokoto and Benue State. States like River and Ekiti, they have much lower error counts. This chart highlights regional disparities in healthcare safeties and quality, which might be linked to local infrastructures or maybe workforce training or even cultural factors. And when we look at the trend analysis surgical error over time, the one below, you can see that it shows that surgical error cases have, have fluctuated across different months and states. There's a peak in September, which might be to seasonal patterns or even specific incidents, and lower case in months like October. So therefore, from this dashboard combines time trend, geographical insights, error type breakdown, and accessible metrics to paint an holistic pictures of healthcare equality and safety challenge. It enables decision makers to pinpoint high-risk states, understanding when error peaks, and also identify workforce or even language gaps. And this design data driving intervention for safer and more equitable care. Thank you so much for listening. Mr. Faith, you can take over from here.
All right, thank you very much for that, Aisha. So we'll delve straight into our conclusion. We'll delve straight into our conclusion. So in order to secure human lives and resources, the health sector needs to be revived. And this can only happen when the medical errors are eradicated. And that is the aim, that is the vision of DSHub. We aim to eradicate those errors. We've identified places where this error is alarming. We've gotten sources where we need to like leverage on. So what are we recommending? One, there's need for increasing healthcare workforce. We identified that so many hospitals lack adequate healthcare workforce. The recommended workforce by WHO is one medical practitioner to 600 patients. But looking at the system now, we identify that we have one medical practitioner to over 5,000 patients. This is very alarming. So we need to come in as a force, as an organization, Abdurrauf, Said, Anamza, Aisha. We thank you all for listening.
Thank you so much. Thank you so much, Faith. Thank you so much, data science, for that um great research, for that wonderful presentation, for that educative presentation. Thank you so much. Seriously, thank you. You've really done well. Actually, I had to cut you off because time is going. If we should stay here now and then you keep talking, yes, it's good, but then time is going and we have a lot of things to do. So please, to our other speakers, once you just see me and I'm clapping too much, I'm reacting too much, just know that yes, start rounding up, start rounding up. Thank you. So we are going to the presentation proper. Dr. Ahmed, are you ready? Just indicate.
Yeah, I'm ready.
Okay, you're welcome, sir. So he had to use another phone to actually log in because he's experiencing some issues. And so Dr. Ahmed will not be able to present using slide. So we are actually going to use a question and answer so that he can actually be able to present his topic. So and he'll be speaking on the topic that says improving pediatric emergency response. So, first of all, doctor, I will just ask you, can you just briefly explain what that means, what it means to actually before we actually go into the question? Can you just briefly say something about the topic? Yes, sir. Okay, yes, sir.
You, can you repeat it again? What you have said?
Okay, can you just briefly tell us how can timely and clear communication improve outcomes in emergencies? How can clear communications improve outcomes in emergencies that is involving women and children? Yes, sir.
by Dr. Ahmed Aladi, the medical advisors. The cultures goes that is what you have said. It is we have some keys. That is we have fast response and better decision making. When we talk about fast response based on the patient, we are first to when a patient was admitted in the hospital, you can communicate through to see how what kind of medication face when the patient has arrived to the hospital. We can clear communication to ensure that emergency response that is under to only effectively. That is to inform them how the condition or how the situation of the patient is. You know, like some other patient relative. When the patient has arrived to the hospital, they will see thinking what is happening to this our patient, what kind of medication or what kind of care was made, and then what kind of situation or what kind of condition the patient is. When the patient has arrived, you can you respond to them. This is how you can see how your patient it is. He's in good condition. Please, you know some other people, some other patient relative when they are they will just start crying to see how the condition for the patient it is. But as far as your medical personnel or your health worker or your weather nurse, midwife, and the rest, you can we have what we call confidentiality, or we have what we call how we can take care of the patient relative to inform them how the condition for the patient how it is. And also we have how the better decision making that is timely communication and able to inform making to ensure that the mother and the children or the family can be make the best choice to see how their care, how you can take care of their patient, to see what kind of medication or to inform. You know, like some other people, like some other patient when they come, when you send them for like let's say for other disease to see what is affecting their patient. Is it the thesis, the result? Is it good? You know, like some other patient when you just see, they will be telling you what is the result showing. They'll be saying let you to inform them. Is it the condition is very safety or the condition is not safety? Then you consider and inform them how their patient it is, how you manage, how you take care of the patient, how you give them the good medication that is supposed to give them in the hospital. I think that's it.
Okay, thank you so much. Thank you, sir. Please, I believe we are all writing down our questions. We are supposed to type it in the, I'm not seeing any question right now. So I believe we are listening. In case of anything you don't understand, you can actually type your question and he is going to respond to that. Or issues within the healthcare system that need to be solved with better systems or training. Some challenges or issues that is within the healthcare system or trainings or trainings.
Yeah, we have like diagnostic error. Diagnostic. When we talk about diagnostic, we are referred to some other like in lab. Those people that are lab scientists. In term, let's say when a patient come, you can when you have done like let's say some other disease. When you tell them, like when you give them, let's say the patient has diarrhea and vomiting. When you just go and test and you see the difference diagnosis, when you inform for the mother of the patient that there is some other errors based on the how the patient it is, they can be happy to see how can they try to based on the lab they have told them that like this patient have this case and they have changed it to another case. They can start complaining, or we can say we have medication management. That is, when we talk about medication management, a trend that can reduce medication error and adverse reaction. Like when we talk about medication training, we are trained. A trend can reduce medication error. Like some people when you come for medication, when you prescribe some other drugs based on like the condition how it is or how the diagnosis is not based on the patient. When the patient has take I think it will be going through, coming back to be going through based on the medication how it is. Or we can say we have another infection error. That is to implement robot infection control system and training can be reduced hospital acute infection. You know, some in other hospital when there is no take care of the how the medication based on the infection how it is, you can see there is a lot of challenges or there is a lot of some orders and there is and also we have um, digital health innovation. That is we have telehealth and we have mobile application. Like our mobile application, we have some machines for taking ultrasound, ECG, electrocardiography, and the rest. And also we have AI. Also, AI powered tools can be predict patient influence, optimize staff. That is to see what kind of condition, how it is, or how the what kind of diagnosis, what kind of treatment can we give for the patient. And also we have predict analysis, or we can see personalized treatment. That is digital health tools such as virtual reality and the AI element. That is we have telehealth service produce target support and the managing specific the condition, how the patient is, how you can take care of the patient condition, how you can manage, how the kind of drugs you can prescribe it, how the kind of patient you are managing, and the rest. I think that's it.
Oh, thank you so much. Thank you, sir, for that. Thank you so much. And the last question, sorry, we are running out of time. What innovations or practices can make emergency care safer for women and children? How can we make emergency care safer for women and children?
Okay, we can say personal treatment. That is to see what kind of treatment you have prescribed or what kind of condition was the patient need. You know, like that in pediatric sector. When they were in a pediatric sector, you know, some other people do like neonatal or preterm babies. When we have find all the kind of tests based on neonatal or preterm babies, we refer them to ICU to see how they take care of them, to see what kind of treatment are they doing. You know, it is no all there are difference with the other those people that are in male surgical, female surgical, or GOPD, that's general patient, and they all like those people that are in ONG, that is obstetric and gynecologist patient are different when in terms of how you can take care of it or how you can manage them.
Okay, thank you so much. Thank you so much, Dr. Ahmad. Okay, I don't know if this is a question, but you were actually supposed to type it. Abubakar, somebody, were you raising your hand?
Yes, I was. Good morning.
Okay, was it a question?
Yes, I do. But I just want to understand. You said we're going to type it. Are we going to type in on the live chat? Then you be the one to read it out.
Yes, that was what I was supposed to do, but he's actually done. So I think you should ask your question because we are calling the next speaker now. So
Oh,
go
okay.
ahead with your question.
Okay, thank you. So my question is, with the coming up of new, schools that's for medical students, some are certified, while some are just mere schools, for the owners to just get monies. How can one, are you guys going to, partner with such schools in a way to more like synthesize the school itself to produce good nurses or better nurses or doctors to avoid such mistakes in the health system or health sector? That's the question I'm going to ask you.
Dr. Ahmed, are you here?
You say?
This question. He just asked the question.
Okay, please, can you repeat the question?
Okay, Abubakar, please can you repeat your question? Sorry.
Oh, no, no problem. Good morning, Mr. Dr. Ahmed. So my question is, there are new medical schools that are being opened all over, and most of them are certified, while some are not certified. They produce nurses and then doctors that are not fully certified, and they go into the system. That's the healthcare sector, and by working or treating on the patients, which eventually lead to what you said during your presentation. So my take is, will the hub, what step is needed, or what step should we take, both the hub and then the citizens, to prevent such uncertified personnel to be treating patients, and then getting the errors, and then which will lead to death. I hope you get the question, sure.
Yeah.
Oh, okay. Thank
Um,
you.
I have get the question. Do you know the first thing? It depends how the hospital it is, or how the availability of the staff are there on the hospital, or how the availability of drugs. Like in other hospital, there are some they're not getting availability of staffs like nurses or medical doctors. Like when you went to other, like let's say general hospital, in some other places you can see only a medical doctor, that is PMO, it is only one, and the nurses are not many, and the other sector, those that are medical record, those are the lab technician, are not many. It depends how the availability of the staff, or how the availability of the goods are there in the hospital. When there is availability, you can manage, you can take care of the patient how it is. But if this, like how the situation some other hospital, when there is not availability of drugs, availability of medical personnel, and there is, when if it is there is availability of that, you can manage to see, you can take care of the patient how it is. Or if there is not availability of that, you can manage to see, if there is like there is available, you can refer them to next hospital for the proper care. It is not all the hospitals that they have availability of equipment or availability of staffs and the rest. Especially when you went to like general hospital, I think it is only in teaching hospital you can see availability of medical doctors, professors, and the rest. Like when you come to here, teachers hospital Meduguri, you can see we have some emeritus, we have some availability of professors, all these medical doctors and the rest, and the nurses. There are many. When you find them, there is availability. You can take care of how the condition of the patient is. But if it is not availability, you can refer them to another tertiary institution. Tertiary hospital. That's it.
Okay, thank you, sir. I don't know, Abubakar, has that answered your question, sir? Are you clear now?
Yes, ma'am.
Okay, I think someone
Oh,
else
okay.
the question. It says, "Thank you for the presentation, Dr. Ahmed. I would like to ask why some medical personnel or doctors find it difficult to clearly explain to patients what exactly they are facing. In many cases, patients are simply told to go for lab tests or to the pharmacy without any explanation of the tests being requested or the medications being prescribed. Why is there often little or no communication about the diagnosis, the purpose of the test, or the treatment plan?" I think that is actually the question. So, doctor, I don't know, is it possible to answer that question within 1 minute? Because time
Yeah,
has.
yeah. No, I don't think I'll answer it based on one minute. Let me just clear it. Um, Thank you for the question. That's very nice question. Like when you come to hospital as a medical doctor, some some patient, when you come, you are asking them, they can't tell you what they are feeling based on how the condition they are. But some other patients are not the one that they are talking, are the patient relative. That they are just say, this one has dizziness, weakness of the body, abdominal pain, and the rest, but the patient cannot talk. After when you send them to lab test, as far as when the patient relative or the patient has to try to tell you that I'm just headache, too much abdominal pain, weakness, joint, and the rest. You can use we have some other terminologies to see what kind of condition it is. You can just go through it to see. You can just write it some other tests like MP Wala, that's malaria, parasite, PCB, and other tests to see, or you can just send them other tests. Let's say some a patient come hospital with PUD, that is peptic ulcer disease. Or we have H pylori to see whether is it positive or negative. Well, if it is in positive, you can send them to lab to see how is it positive or negative. Some other patient where you just when they complain like they say PUD, when you just prescribe them the drugs. Maybe when they went to pharmacy, like in terms of prescribing, when the patient complains he has too much PUD, you can prescribe some Barol, Gaviscon, and the amoxicillin 25 and trace. When you prescribe, when the patient goes direct to the pharmacy department, that's why I have just told you like some other hospital they do not have availability of drugs, or when there is not availability like this Barol and Gaviscon and the amoxicillin 25. When you tell them let them go and buy, they will not just buy. They just throw the prescription sheet away. And then some 2 to 3 days, they will just come back to the hospital. The same complaint, we just prescribe another drugs. If it is in terms of when you have said some other patient, they will tell you that I ordered drugs, I have taken, and I did not hear any comfortable for myself. But the patient he replied to, he did not buy all that kind of drugs. You to that time you'll be wasting your time prescribing for them all the kind of drugs that is possible to them, but they are not purchasing all the kind of drugs. Because why? The drugs, we have three kind of prescribing some drugs. Some other people they used to prescribe for the first, second, that when we went to that, that is in like let's say primary, secondary, and tertiary. In the primary, you can write omeprazole and rest. For this, the secondary, you can write the baron, capsule, and the rest. But if it in tertiary, you can write them IV barrel and the Gaviscon and rest. That's how it is.
Thank you so much, sir. Thank you so much, Dr. Ahmad. I believe the person that asked the question, I believe your question has been answered. Thank you so much. So please, with that being said, we're going to move on to the next speaker. And the next speaker is actually supposed to be Barrister Aisha here, but she's not ready yet. So we are going to call the fifth speaker, which is Mr. Abdurrahman Abdurrahim. I don't know, please, if you are ready. Mr. Abdurrahman, are you ready? If you are, can you please indicate? Yes, please go ahead, sir. You're welcome.
Good morning, everyone, and thank you, Gladys, for the introduction. Sorry, you might have to bear with me. Not a bit well today, so it's a pleasure to be here today. I'm Abdurrahman Abdurrahim, a product designer with focus on human-centered innovation. So for the next few minutes, I'll try to make it short and well explained. I'll be sharing how thoughtful design not only enhances clarity but safety in healthcare tools, which is a topic that is both timely and critical. But before I go further, let me just walk us through on the three key areas I'll be talking on, which is design decision, when designing in healthcare, design is not just about the looks, the aesthetics. It also has to do with how well a product works, especially in an environment where every second matters. Hello, please. If I'm audible enough, kindly indicate so that I can keep going.
Yes, we can hear you. Go ahead. Sorry.
Sorry, sorry once again. So as I was saying, bad decisions like poor contrast, overcrowded screen, or even placement of buttons can be the decision to lead to either life or death. Now, imagine you as a healthcare practitioner. You are using a product which is used to record patient vitals. Upon collecting all the vitals, unfortunately, in the layout, the clear and the save button are placed side to side with each other. Instead of pressing save, you went ahead and clear. Due to this kind of decision, this kind of things happen as often as we can assume. And secondly, let me bring another case study. Imagine now you are using a product or a software that is used to monitor patient condition. So as soon as you press on a patient's profile, you opened it, the first thing or the first label you saw was condition critical. But the other problem now is the condition critical was shown using a green or let's say a blue color. So now even that delay in interpreting what you actually see might cause serious issues. Or let's say it actually shows, but there's no label that shows which ward that patient is. So we have to start searching around the screen where is this actual patient, and that alone is enough to cause serious and unnecessary disasters and risk, especially in healthcare sector. So therefore, simple design decisions like font type, button placement, and color contrast in designing healthcare products is not just about aesthetics or cosmetics, like I said before. They guide users' eyes, action, and attention, especially in high pressure environments like healthcare. So moving to the next key point, which is user involvement. Okay, now you have decided on which color, which layout, how to place your items. So the next question is, who are you designing it for? What I'm trying to say is, now before starting design is not about designing for the user. It's about designing with the user, specifically the doctors, the nurse, and patients, since we are talking about healthcare sector. Now, by speaking to them directly, we learn about what really matters in their daily routine. What do they actually need? What causes delay? Where do errors commonly happen? What feels intuitive and what does not? Now, let's say, for example, now for a nurse which records patients' vitals between, let's say, a round of taking a test, you realize maybe she has like it takes her about 30, I'm using a case scenario here, 30 seconds in order to record the patient's vitals and other things. So how do you know what she actually needs or what causes her to take that particular time to record a patient vital without actually asking her? So therefore, by listening carefully, we uncover pain points that we would otherwise miss. And this approach is known as human-centered design, which ensures solutions are not only functional but also genuinely helpful. And lastly, for my key points, I have here testing under pressure, which I would say is designing for real-world condition. It's not about just designing a healthcare tools and or let me say before we take it live. It must be tested thoroughly, not only in calm and well stable environment, but also controlled settings. Sorry, we also have to simulate a real world stress condition to see how users behave when under time pressure, multitasking, or even facing distraction, because that is often the reality in medical settings. This kind of usability testing will help us identify weak spots in the interface. Let's say in an emergency or an ICU ward, a nurse is about to record the vitals or, or to attend to several patients in little amount of time. The idea is she might not have time to start reading through each level or knowing, okay, what does this does, what does this does, what does this does. She will have to like it to have it become like a reflex action to her. So does that interface makes it possible for she to perform that task as fast as possible? Are users hesitating when using the app? Are they making avoidable mistakes when under pressure? And finally, do they understand what to do and when they are to do it, what to do, sorry, even when they are in a rush? So, by observing and iterating based on these feedbacks, we can refine the design to be more resilient, clear, and safe no matter the circumstances. So, in conclusion, enhancing clarity and safety in healthcare tools, we just summarize what I say entirely in this call, depends on three key things: smart design, smart design decisions that reduces confusion, deep collaboration with users to uncover real needs, and lastly, rigorous testing to ensure tools work reliably even in moments of stress. And let me just use this to end my presentation. Sorry again. Lastly, in healthcare, design is not just about creating a good user experience and making good looking design. It's also about supporting better outcomes in the sense that a very good design, like said by all others in this meeting, would go a long way into reducing errors in healthcare and diagnosis. So, thank you all, and it's a pleasure being and delight having to present this topic for you. Thank you very much.
Thank you so much, Mr. Abdurrahman Abdulrahim. Thank you so much for that educative presentation. That was a presentation enhance clarity and safety in healthcare tools. So I believe that we all learned a lot from that. So in case you have your analysis, just type it, please. Sorry, we don't have to be reading out the questions. We'll do that later. Any of the speakers that spoke, just type your questions in the in chat there, and we're going to read them out later and answer it. So with that being said, I'm going to call on the next speaker, which is Mr. Lawal Abdurrahman Adewale, the product manager at DSHub. Can we please celebrate him? Can we please celebrate him? Thank you so much. Yes, sir.
All right, thank you very much. Good morning, everybody. Let me confirm if everybody can hear me. Gladys, can you confirm? Can you hear me?
Yeah, fine.
All right, perfect. Thank you very much. So, good morning, the CEO and founder of DS Hub, members of the management team, members of staff, the interns here present, participants here present, distinguished ladies and gentlemen. Good morning, everybody. As already been mentioned, my name is Lawal Abdurrahman, and I currently work as the product manager with DS Hub, and I'll be speaking today on building digital products that prioritize clarity in healthcare. Before I proceed, most importantly, I listened to the speaker before me speaking, our product designer, of course, Mr. Abdurrahim, talking about some very, very important and vital things that I was also going to mention at the course of my presentation in terms of clarity, right? Since this is a Clarity Health conference, and most importantly, I am going to be, delving into digital products that actually prioritize, clarity in healthcare. But then, for us to really understand some of these things, I think it's very, very important I start with some of the problems that can come up or occur before we now talk about how some of these problems can be solved and how we can get clarity in terms of healthcare delivery and precision medicine. Ladies and gentlemen, it's been interesting to know that we have certain things that people do most of the times that are not exactly what they should be doing. Number one would be in terms of, you know, building apps just for building sake, right? You want to build an app that solves healthcare problem without necessarily knowing if that um, app is going to actually correct or solve problems rather than create problems. I think this is something that many of us actually do most of the time because of the enthusiasm to actually make impact immediately. So one important thing is that while you this mistake that would occur include first, creating apps that actually have misrepresentation or misinterpretation of data. So you want to create an app that probably solves problem of just taking vital signs, and because you want to like make it digitized, you want to prevent them from using traditional card and that kind of traditional method of collecting data. You now want to bring in a digital platform where people can actually input data, and then you now make it in a way that you are putting, let's say for example, you are instead of like really looking at what they do, whether they measure blood pressure in millimeter mercury or they measure it in another way, you want to now bring something different, which can actually cause some kind of problems to understanding and interpretation of some of this representation and interpretation of some of these important data. And that thing that can happen again is, errors in medication, because sometimes you want to, build apps without necessarily going through research, without working with people that are actually in that particular space. I think it's something that all of us can attest to in terms of all of us working with DSO. One thing we have noticed is that we have experts based on whatever product we are building. We have people that are actually working in that particular space so that we know that whatever it is we are doing it correctly. Now imagine you are building just same thing in terms of healthcare, building an app for um, you know that is going to predict, or let's say you want to get medications, right? And then just like someone asked me some days ago that okay, you want to allow people to be able to get suggestions of medications. Now, how do you now bring this out? Do you bring it out in terms of the brand name, or you bring it out in terms of the chemical name? Now, what am I saying? For example, now we know that acetaminophen is what some people refer to as paracetamol. You understand? Now, you want to now build an app, and you want to have this medication based on recommendation based on the situation of the patient or the condition of the patient, and then you now end up start using brands like you now start saying Emzo as a medication suggestion, or you say M and B. Have you solved any problem? So this is something that that is, I don't know, as any problem is solved that way. If a problem has been solved, you might want to probably type in the in text or in call message that a problem is being solved with typing MZO as a medication or M and B. Okay, since there is no response at this moment, I believe that we have understood what I'm trying to communicate here. So one important thing is to actually know that for every medication, we have what we call the chemical name, and we have what we call the brand name, right? Another kind of name, right? The chemical formula showing that okay, this is exactly what this medication is, and the dosage, the quantity, and everything. This is something that actually people can actually make mistakes on. So one important thing is to know how to really communicate some of these things without necessarily causing more problems to people or wasting more time when you're trying to save time in delivering in healthcare delivery, basically. Then the next one would now be uh, some apps again that's actually not actually solving the problem, but then creating more problems like delayed diagnosis or even misdiagnosis. So all these things is based on the fact that people actually build or many people build based on enthusiasm, based on interest, without necessarily building to actually solve the problem or a problem that is currently occurring or that is occurring. And all these things can be, can be prevented with so many things. First of all, is to know when to build and how to build. As speaking as a product manager, right? In building, for every kind of products you want to build, there's something they call the ideation phase. But then, whatever ideation you are having, whatever idea you're having, you need to validate that idea. Idea validation comes from needs assessment. Okay, it comes from assessments of people that are actually in need of this particular um, they're actually in that problem. You understand? You want to check if there's really a problem that you are ready to solve whatever products you are trying to build. If there's a problem that you want to solve with the products you are trying to build, then you have validated that particular idea. Now the next thing is now to look at the solution that you are going to provide. Will it actually solve again? And that is where what Mr. Ibrahim said earlier, that you build with people, you don't build for people. Okay, you build with people so that when you are building with them, you know whether you're actually solving a problem or solving their problem, or you're not doing anything at all. You understand? Because effort without purpose is still the same thing as wasted effort. That is to say, you don't have a reason for doing something, you're just doing it. Then nothing is actually going to happen. Even if you actualize a particular product, it's one thing that is sure is that it will not last. You understand? It will definitely fail. Right. So one thing that some of the features that you can actually put in place to ensure that all your apps are actually used easy and safe, okay, because of clarity, is first to very, very importantly, just like Mr. Abraham said earlier, you want to look at intuitive navigation. So what am I saying in terms of intuitive navigation? For any app you're going to be building, you want to look at whatever interface you're going to be using. You understand? You want to ensure that, okay, if a user, say for example, because at this point in time you are building for probably a doctor or a medical personnel, right? They should be able to know, okay, this is something they are familiar with in terms of the icon, in terms of the color selection and all these things. And then they are able to, follow through that process, allow them to ease over fears in terms of the navigation, right? From, okay, I'm going to take you through the patient's whatever dashboard or to homepage or, to medication, depending on whatever it is you are doing, you understand, or data collection, interpretation, and showing everything. It shows through navigation that, okay, this is what this icon shows this particular screen. The next one is showing this particular screen. So these are some of the things that you want to actually put in place while you're actually preparing to build, okay, in terms of design. Then the second thing is clinical decision support tools. Now, when we say clinical decision support tools, first of all, we know that whatever product you are building is actually going to actually solve the problem that you want it to solve in terms of the healthcare delivery. And then you're ensuring that it's what, you know, there's clarity, right? So ensure that, okay, people are not getting confused, right? Like I said earlier, clinical decision support tools. Now, in this case, now when we say clinical decision support tools, I'm saying earlier, or I've said earlier, basically, just as I want to give a very good example. So I'm still trying to bring it out. I wrote it down, so I want to quickly go through it. Now, clinical decision support tool basically is that um, in the case where, say for example, now we have like some AI powered tools, right, that allows some of these healthcare professionals to like get relevant information or insights. So for example, now um you have an app that you have built, and then you have, like, let's say an AI interface that actually suggests or recommends some of the things that probably the doctor would do. Take notes, it's just recommending. Most of the times you need to ensure that and AI is not making the decision, it's just supporting, right? Or giving some insights on what can actually be done. So that's like something you can actually look into. Another thing again that is very, very important is data analytics. Uh, for many of us now, we already know that at this point in time, and most of the decisions that we make are guided by data, right? Most of the decisions that we make are actually guided by data. So if you are building something, you should ensure that um, you have that part of the data analytics that allows you to like make what informed decision making, right? Decision should be your decision should be informed by what the data that has been provided. You understand? And this is very, very important because when we study the antecedents, we study records of what has been happening with other kind of patients, or even that particular patient, in terms of the recovery, or in terms of the damage, or the condition of the patient going deteriorating. All this data you have collected over time, in terms of, say for example, the patient blood pressure continues increasing, or it continues to increase every single hour, it simply means that something is actually wrong. Whether you are giving the person a blood pressure you know reduction, and maybe an antihypertensive drug, right? Basically, we're giving the patient an antihypertensive drug, and this patient blood pressure continues to increase. You need to actually have some of that. There is no response. What you're just seeing is what deterioration. So when the health is deteriorating, what would happen? So it's something that you can actually build to allow the doctor to actually make what informed decision right? Another thing again is another feature that you can actually put into an app to allow it to be easy for for it to be clear, to be easy and safe to use is secure data storage. Now, the data storage is something that cannot be overemphasized. You have data analytics, right? You still have to also be able to store some of this data. Most of the challenges that people actually have currently is that most of the data actually comes in terms of their apps that they're building, but there's no storage of this data. And then the reason why data needs to be stored is because of future reoccurrence or something. So you can go back and study the response or the behavioral response or the body response to particular medication or treatment of that patient given. So you are building the app now as probably a software developer or an engineer or a CEO or anything. And you want to ensure that whatever you are building actually helps the person that's going to be using it, the user itself. You understand? To be able to like, okay, I have this data stored, I can go back to that data. But this data now has to be secured. Why is it secured? Why is there need for security? There's something that probably the legal officer probably would have said already since I joined late with regards to patient data, security of patient data. You understand? There is an act already, Nigerian Data Protection Regulation or law, NDPR, and there's also the HIPAA Act, of course, that is used in the United States. Patient data are not supposed to be exposed just anyhow. So you have to like you have put the feature of data storage. Ensure that you now put the future of secure data storage. You understand? Because of time, I don't want to really go too much. Another thing again that would also be important would be the interoperability. Uh, Basically, just the word inter, then operability, right? Allowing for people or systems that are actually in existence to be able to work together with whatever you're building. What we're saying is that you have every maybe hospital or maybe any healthcare provider or private individuals already have what works best for them. Whatever you're building now, you need to allow it also function, right, with what you have in terms of okay, you are bringing something new, allow it to be able to allow your app or your products or whatever you are building, maybe your website, to be integrated into what's already existing. You understand? So what you're going to be doing basically is to either optimize what they're currently doing at the moment in that particular facility or what the individual is doing. Or you want to make it, yeah, basically you want to make it better than exactly how it was before. But never that you want to now remove one completely to now bring in yours. That would be a lot of things. Now, another thing I'm going to discuss again after having discussed some of the problems you have seen and how you can bring your features that would solve some of these problems. The next thing would be, how can you now design for rural areas? Because you might think that you have some of these things. Okay, let me confirm if there's a problem. That is
Your time is up, sir. Can you just round up?
all right. Thank you very much, everybody, for listening. Let me just quickly summarize so that I'll not take much of the time. Basically, in terms of training people in the rural part, you need to look at training them. You also have to look at how they can navigate some of these apps and be able to use some of these products. So, because of my time, because I thought I started 10:30, but now I'm seeing 10:39. But notwithstanding, I believe that for all of us that have listened now, I believe that when you want to actually build anything, you prioritize clarity, and clarity is very, very important because you don't want to create problems. You want to actually solve problems. Thank you very much for listening.
Thank you so much, sir. Thank you so much for that educative session. Effort without a purpose is wasted effort. And building to solve a problem rather than on enthusiasm. Thank you so much. Thank you so much, sir, for this educative session. So please, you have your questions. I believe we should have questions based on this presentation. So you can actually jot down your questions. So you can drop your questions. I mean, thank you so much. So I think Barrister Aisha is actually is ready. So can we have you now, ma'am, Barrister Aisha? Can you please go ahead? Can we please welcome her? Thank you.
Hello, everyone. Good coming in. Um, I hope everyone is doing well, and I've been listening, even though I wasn't able to take my own slot, and it has been a very interesting session so far. I had a few things spoken by some of our speakers that I felt had some legal implications on. So I'm looking forward to my own session. So yeah, Gladys, by all means, I'm ready.
Okay, you're welcome. Okay, I guess we're going to do the same thing we did with Dr. Ahmed, right? So we're going to just take it that way. Can I have 1 minute?
Yes, yes, please. Gladys, was that the go ahead or am I waiting for you?
Sorry, I didn't know my mic was muted. Please go ahead. Just go ahead. Thank you. Go ahead.
Okay, so I think one of the first questions I would like to speak on has to do with clear legal guidance and how that would reduce the risk for both patients and health workers. I think one of the biggest issues we have in regards to the health sector is people look at the law in respect to when things go wrong. Like, how do we fix a problem instead of, you know, being in compliance from the beginning and making sure those particular issues don't arise. When it comes to health workers specifically, they feel more confident to do certain things because there are protocols that they are following that if anything should go wrong, they would be able to get back to and, basically say, this are the protocols I ended up following, and to be able to get to this particular decision. When it comes to patients, they feel more respected because their rights are being understood and upheld. And when it comes to the institution at large, it reduces the exposure to like lawsuits and regulatory sanctions. So um, you have to look at, there are a lot of healthcare provisions available in Nigeria, and when those particular laws are being followed and those rules are being followed, it makes it easier. And I think one of our speakers pointed out that there are 3% death cost in Nigeria, according to WHO research, by negligence in respect to the healthcare sector. So these are things that could be able to reduce if certain protocols or rules are in place that are being followed. That is not to say that these rules do not exist. The point is they exist, but the institution or the sectors do not follow them or abide by them. The typical Nigerian does not even know that he has certain rights in respect to how he's getting treatment, medication, or in the health aspect of things in general. So, one of some of the laws I think that are very important would be the Nigerian Data Protection Act, and we also have the. I'm sorry, I'm blanking out right now. But Gladys, can you help me with the first question that we have for me to go through? I'm blanking out a bit right now. Gladys.
Okay, yes, I'm coming. Please just in it. Sorry about that. I'm getting it now. I'm coming. Okay, yes, legal guidance. Reduce risks for patients and health workers. How does clear legal guidance reduce
Perfect.
health
So I think what I was looking for was the Nigerian National Health Act, which basically covers all the things in regards to the health sector and how things could be done, and the procedures to be followed. And clear guidance that reduces risk for patients and health workers. The first thing is ensuring everyone knows their legal duty. You as a patient have a duty to the person giving you care, and you as the care provider have a duty to the patient. It's also defining patient rights and expectations. It's also providing legal protection for the professionals. I'm sure most of us within the legal, within the medical field too. Dr. Ahmed would agree with me. There are, certain protection you would expect from where you work and from the institution itself, the institution and the sector as a whole, to make it easier for professionals to be able to do their job. The Nigerian National Health Act basically provides, the most important thing is health services with respect for human dignity and rights. Legal guidance also minimizes risk for health workers. That is why it's extremely important when it comes to documentation and also in terms of like the scope of practice, policies, and standard operating procedures being followed and the likes of it. Um, a healthcare system without legal guidance just exposes them to both litigation and also unnecessary harm, and also a lot of patients, lack of satisfaction, and of course, death. So, yeah.
Okay, thank you. The next question: what are the common legal mistakes in healthcare, and how can we avoid them? Common legal mistakes in the healthcare system, and can we avoid them?
Okay. There are lots of legal mistakes within the healthcare system. I'm going to try and go through a few that I can think of at the moment. The first one, and I think the most important, even beyond the healthcare system, is consent. Consent is extremely important, even in terms when you're doing something good or for the betterment of the next person. The Section 23 of the National Health Act also gives legal for consent, and not just consent to let me take care of you, let me give you this medication. Consent has to be by someone with capacity. So you have to be able to prove that when that person give that consent, it's not when someone is dying of pain and you're like, oh, do you need this morphine? And you administer it to them, and they sue you 2 weeks later, and you're like, no, they said you wanted it. Were they within the capacity at that point to give that consent is a question that has to be answered. And also, we have to be informed of like, okay, if we give you this particular medication, there's a possibility you're going to die in the next 3 years, or it leads to cancer, or it prevents pregnancy. These are all questions you have to look at in respect to like consent. Have you answered all of this? Is it voluntary? Does the person have capacity? And also, do they have the full information of the risks, of the benefits, and if there are other alternatives? Another thing would be breach of patient confidentiality. Um, I think within, I don't want it to respect it to just interns or junior staff because, from experience, we're all human. But it seems very casual, when you're speaking with the next person, a friend, a family member, to tell them, oh, work was so good today. Someone gave birth and, her intestines came out or something like that. I'm just giving an example, to basically put this point across. It's just by the way you said that. Mistakenly or to the wrongest person, you are able to give that information and you let one or two things, patient information apart from that story, maybe the name of the patient or the name of the hospital, and you tell the next person and you tell the next person before you know it, it's something that is like national news or, oh, have you heard? And then someone is like, oh, that's me. That is something they can take you to court for and basically sue you. So it's extremely important for you to take confidentiality, of utmost importance. Another thing would be just by the way, poor documentation. Legally, anything that is not written, anything that you cannot prove, patient medical record, it did not happen. You cannot go and tell stories of this is what I did, this is what happened, this is what I administered. If you cannot bring patient record or prove, within the management that okay, this is it. This has been, this is when AI and technology comes into place. Like beyond, okay, I logged in at this time on this date and it says here, and you can able to show it, and it will be very hard to doubt otherwise. um Unclear scope of practice, everyone's doing everything, the nurse is doing the doctor's job, the doctor is doing the nurse's job. I'm not sure within, the medical field, this is something Dr. Ahmed will be able to say, but it is if it's not within your license, if it's not within what your job is, even if you're licensed to do something, but your employment letter does not allow you to do it, you can be taken to court about it. Litigation can arise from it, civil disputes, criminal disputes. These are all things to look at. And I think lastly, I would say non-compliance with health laws and also digital health laws, which is specific to DSHub and technology. There are always new bills that are being passed, always new laws, and in most cases, people just look at the things that are just in front of them. When I was in medical school, these are the things that I was taught, so these are the things I'm looking at. You have to be up to date with what is going on. Of course, most of the times it's expected within the institution and the sector for them to be letting, them know that this is what's happening, but as an
Thank
individual,
you
you
so
also
much.
have that responsibility.
Thank you, Aisha. Can we go to the last question?
What would that be?
And the last question is what legal tools can protect safety without delaying medical care? What legal tools can be used to protect safety without delaying?
Okay. I think I would give response to at least two. The first one would be standardized consent forms because I'll also give it in respect to the fact that we spoke a lot about rural and urban and language barriers and all of that. It is very important that consent practice claims and to make sure that legally things are legally vetted to basically save time. So if someone is in the legal capacity to be able to give consent, they do. If they are not, the closest person to them or the closest person that would be able to give that should be able to be there to give those to give that consent.
The malaria parasite, is it 1+, 2+, or 3+, and the rest? When you prescribe them like this, then you can write them whether augmentin 625, that is amoxicillin or azithromycin or clarithromycin. Like according to WHO, when you are just trying to treat malaria, you should stop using antics. When they are just prescribing a malaria case, they used to put antibiotic. In terms of treating malaria, you can just prescribe whether ACT and DCM, whether you can add and when if they can just add this thing, albendazole suspension or tabs and the rest. That's how it is.
Okay, thank you very much, sir, for that. Aisha Hamza raising up her hand. What question do you have, Aisha Hamza? Aisha Hamza, you were raising your hand the other time, or your question have been answered. Let me go to Miss Sharifat. Okay, Aisha Hamza, you have the floor. Ask your question.
So sorry, my question is actually directed to Dr. Ahmad. So my question is, like, how can we, like medical practitioners, there are some medical practitioners that are not negligence at all. Like this has actually happened to me like twice, but God saved me actually because I understand the language, but they don't know that I actually understand the language. So that was what saved me then. So my question now is, how can we reduce this negligence because of something like that. Thank you so much.
Okay, a doctor that is not understanding your language, that's what you mean by?
No, the thing is, what actually happened to me then was I was asked to go and take a test. So I took the test, and when I now brought the test, so unfortunately, I didn't get that day. So I met other people there. and he was like, he was now speaking the language. He doesn't understand what the test is saying. He will just write some drugs for us, let her go and take, and that will be all. So when I heard that, I just tell him that okay, don't worry, I'll come back some other times. That one was one. Another one was even a doctor.
Uh, is it a medical doctor that you or a nurse? Which one?
He's a nurse. He's a nurse.
Sorry, I say the first time and the second time that the patients, the doctor, the nurses, both of them, to, the first one and the second one, all are nurses,
The second one was actually a doctor. The second one was a doctor.
but the first one is a nurse. Hello, I said the first one is a nurse and the second one is a doctor.
And for the doctor, what happened
No,
was I was having
what I
hello.
mean, hold on. What I mean is that the first one that see you is a nurse, and the second one was a doctor see you. But
Yes, 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 yes.
there is different experience and there is different background for how there is difference between medical doctor and the nurses,
Yes,
and there is
actually.
yeah there is different experience. And like
Yes.
in the hospital right now, we as we are medical doctors, other nurses are not take care of no sorry they are just take care of patient, they are not prescribing. When we just send a patient to be admitted on bed, the nurses will just go out and put them an infusion, give them medication. That's how they are just doing in the tertiary level. But if it is in secondary, some others health facilities or some other this thing, general hospital, the nurses can see a patient. But if this there is some medical doctors, the nurses cannot see a patient. That's how it is. There is different experience, there is different background, there is different qualification. That's how it is. I have my question goes direct, but you understand how it is, but
Yes, 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 yes.
so that's the differences.
All right, thank you, sir.
Thank you very much. Let me take the last person because we're running out of time, Miss Sherifat. I saw you raising your hand the other time.
Okay, yeah, I just want to back up. Can you hear me?
Yes, you
Okay,
can go
I
on.
just want to back up what Dr. Ahmad has just talked about with respect to the previous question and this very question. Um, when it comes to ambiguity of terms used to communicate to the patients, one of the best practices I would suggest is we were also taught these terms. We didn't just grow into knowing, we didn't just wake up knowing that this term means this. So when relating to your clients, your patients, you use the terms that you were familiar with at your earlier stage when you were still coming up at your career level, the early stage of your career level. For instance, the second question she talked about, the second person talked about where some doctors or nurses have used words that scared highway. I've also experienced that, but because I know of what, even if that is what it ought to, because some of them actually misinterpret when explaining these things to patients. But even if that is what it is, you as a practitioner should get lesser ways, because when you tell them these ambiguous terms and it scares them, these are one of the things that takes them to go and take any prescription they are given, because they feel it's a very serious issue. So anything I'm giving, I could consume it. So you try to get lesser ways of explaining it to them, most simplest ways, the way you knew it when you were still at your early career stage. Thank you.
Thank you very much for that, man. Now we're moving to the last item on our agenda, which is the closing remark by our CEO. I really enjoyed this session. I wish we were going to add 2 to 3 more hours so that we'll continue to be more educated and enlightened about this clarity health. But we have to just move on and conclude. And our CEO is going to give us the closing remark. Thank you very much, sir. You have the floor.
All right. Thank you very much, Aisha Waziri. Thank you very much, Ms. Gladys. Thank you very much, all the speakers who have given their contributions right from the beginning. I want to thank you all because you have contributed to this program and making it a very insightful program, helpful program, and a program that will benefit all audience. So thank you very much all. I have been taking some notes actually. Can you all hear me?
We can hear you, sir.
So I have been taking some notes right from the data science presentation, and I've taken down some notes. I've outlined some of their findings that came out of their research, and some of the things that they have outlined, they are very, very important, very, very critical, especially in the local context. Because when you want to address the problem, the problem that maybe involves with communication, right? The problem that cause keep patients in danger, right? You want to provide patient safety. You want to do solution that is built for people local with local context, right? That will make an impact locally, right? There are so many things to be considered from the data science presentation. Of course, we have seen what they have mentioned. They have mentioned of the problems usually uh, local context problems. The mention of limited workforce in Nigeria, right? Of course, everybody knows that. We have poor database. Yes, we have poor database. And also, there is a problem of miscommunication. There is problem of incompetent personnel. And there is lack of technological software solutions. And if you look at the aim of DSO, it's actually
Sir, I think your network went off. We can't hear you from now.
what build technological solutions, support that, and also what be a pioneer in pushing out initiatives and also empowerment. Can you all hear me now? Please kindly indicate if you can all hear me.
Yes, sir, we can hear you now. You're back online. We can hear you.
Sorry, where did I stop?
It was just few minutes. You can continue, sir.
All right, so based on my own point of view, my own perspective, and also the experience I have going to some countries, like I've been in some countries, of course, my experience in Malaysia, Singapore, China, they have addressed they have attempted to address, so they have addressed this foundational root problem that the problem that we are facing here in Nigeria, because we are a developing country, and Malaysia, Singapore also, they are a developing country. You can put us in that context. But what they did right is actually to address the what roots of the problem, right? To improve their traditional method of our healthcare system. And they do that by what? Localizing their what? Instructional materials. Because, for instance, in Malaysia, they have Malay as the official language. Then the second language is English. Then there are other languages like Chinese and also Tamil. That's from India, right? So what I noticed is that across their hospitals in Malaysia, they usually publish instructional materials based on demographics. So if I go to Penang, Penang is the state in Malaysia, mostly dominated by Chinese. Can you all hear me?
Yes, sir.
Am
You
I
are
all
clear and
audible?
audible. Yes, sir.
Yes, dominated by Chinese, Penang. Most of their hospitals, they make use of localized instructional materials. So on the instructional materials, you will see Malay and also Chinese, because there are so many Chinese population in that area where that hospital is located. If you come to the KL, which is the central capital, where you what you see is English, Malay, right? On the instructional material. See, because they have so many locals that their English is not their first language. So they resolve what using what alternatives, which is their local language, to what have a better clarity, instructional, helpful materials to what improve patient outcome, and that's what they have been doing for so many years that have put them ahead of Nigeria because Nigeria is not because we don't have the workforce. It's not because we don't have the expertise. We do. We have them a lot, but we lose them because this expertise confined Nigerian medical professionals. They go abroad to what? Improve the
The network is fluctuating again.
hospitals there and also the healthcare system over there. But we lose them here. And but we have am I audible?
Yeah,
Am I
the
audible?
network is seizing.
Yes, sir.
Hamza.
We can hear
Am I
you.
audible now? Yeah.
Yes, yes, sir.
So we usually lose our what? We use our healthcare professionals, right? To other countries, right? If you go to Malaysia or any other countries like UK, you find so many Nigerian doctors there, right? Very qualified, right? But the issue here is that the problem is they're here. We lose a lot of them. Just this morning, I was reading an article. I saw the leader of the Association of the Medical Doctors in Nigeria complaining that the federal government is what working to send more qualified medical practitioners to Caribbean countries, European countries, and other African countries, while we are what short of them here in Nigeria. This to tell you that there is so many issues that need to be resolved, which is from the grassroots. And when we don't have enough qualified medical practitioners, we are left with unqualified, and this unqualified, they are really not being trained well. Then we are going to any solution you are going to do, it's useless, right? Because there is this saying, anything that cannot be understood, that thing is useless. Whether it's a technological solution, whether it is an initiative or empowerment program, as long as it cannot be understood, that is pointless. So you have to make sure that there is clarity, there is a very good communication. That thing you are working on is actually what speaking to the context of the people you are building that solution for. That is how you want to make impact. That's why if we are really want to improve, we are not just looking at the technological solution. We have to also look at the traditional method, how we can improve them, because the only way is to what provide clarity, and the only way, because Nigeria is very diverse, you can't assume that people can understand something, right? If you look at all our instructional materials, especially in the healthcare sector, they are all what even English, right? And that is a very, very huge problem. I think that's all I have to say. I wanted to contribute that during the program. Yes. So, sorry for the closing remark. All I want to say is thank you very much, everybody, for being in this call. This call, this meeting, seriously, this meeting, we have never hosted a meeting like this. And one thing I want you to know is that this meeting, everything you see from the original content you have been seeing online to the coordination of this whole event is all done by our exceptional team of Otondo interns. The interns that we are graduating today, that's our core interns, and that's their work. That's the work they have put in over the 9 weeks period. And this is them organizing a large event like this. And this event will be a memorable event, remarkable event that can be what? Remember every time, because I will always remember this event, because this is an event that this gives interns, right, it expose the interns to what a lot of opportunities if they can be able to what host something like this, right, which is very, very, very helpful, beneficial. I think they have done more than being an intern, definitely. And of course, we have hired some of them. And of course, right now we are in our Cohort B internship program. A lot of new interns have applied as well. And we are going to start by next week. I'm sure it is going to be more very useful. And I'm hoping we want to do more than what we do in the Cohort A internship program. So I think that's all I have to say, unless maybe someone have patience for me. But we have taken so much time from the 9 a.m. up to this point. All I'm going to say is just thank you, because words cannot express how joyful I am because of the dedication, commitment you have put in to be in this event uh, this day at this moment. Thank you very much. All thank you so much, Mr. Abubakar, my right hand colleague, for being in this meeting right from the beginning. Of course, I know you have really cancelled a lot of your plans just to be in this meeting. And also, I've recognized one of my colleagues, academic colleagues, my auto class monitor, who has been in this call for so long. Thank you very much. I really appreciate. And Dr. Ahmad, thank you so much. You've been in this meeting actually has reshape everything because you have really someone with a, someone with experience, real world experience, what have answered a lot of questions, have addressed so many things to people, right? Because if you want to really hear something credible, you need to hear it from the people that are in the front line, people that practice that. And we have we are so grateful, Dr. Ahmad. Please understand that we are so grateful. Dr. Ahmad is also part of our what advisors at DSHub, so we are always together. Unfortunately, Ms. Aisha was not able to attend, but she has also been contributing so much to the effort. And of course, some of you will know about will know her, Ms. Aisha. And also want to thank my own legal advisor, Barrister Aisha Tahir. And thank you so much. You have really done well and contributed. You have contributed incredibly well, right? So much happy you've been in this program. And to others, please, sorry if I did not mention your name. Just understand that I'm so much grateful and thank you all for being in this for contributing. Seeing this program come to an end, and thank you so much all. I don't know. Sorry, back to you, Gladys. Yes, thank you so much.
Okay, thank you so much, sir. Thank you so much for that great presentation. Thank you so much for that closing remark. Thank you so much, and I believe you almost
I
everyone.
just want I just want to make a single point, ma. All that he has said actually is very nice, and we cannot be the best and successful interns as the first set without our supervisors. So I want to use this medium to appreciate you for grooming us and taking us through our 9 weeks journey up to this stage. Thank you very much, our supervisors. Your efforts have not been is not overlooked. It's also appreciated. Thank you very much. Ma, you can conclude, ma.
Okay, thank you so much, Aisha. Thank you so much. So, is that all you have to say? Because I just want to round up everything.
Yes. I wish us all a happy day. Thank you very much. Happy weekend.
And thank you so much, everyone. Seriously, thank you so much. Before you go, let me just say this. Also, thanks to the cohorts A interns. Thank you so much. As in for the presentation, let me just say this. This came as, will I say, it was just very urgent. Like I know that Rabia, to the first person that presented for the interns, it was just yesterday, but we can just see the presentation. It was just awesome. Thank you so much. Thank you so much, the data science. Thank you, even the graphic designers. I don't even know how they did it, but it's everything was just perfect. Thank you so much, everyone, for being here. So, wishing us all the very best. To all the supervisors, also, thank you so very much. Tijani, Nabihat, Fatima, thank you so much, everyone. Thank you so much, Mr. Lawa, for being here, sir. Thank you. And all our guests, in case your name was not mentioned, please. Thank you. And we hope that next time when we invite all of you again, we are going to have this number and the double of it. Because today being Saturday, as in we know that you're supposed to be sleeping, you're supposed to be doing one or two things, but you decided to sacrifice that time and honor our invitation. Thank you so much. And we believe that next time when we invite you again, you're going to come in and you will invite others. Thank you and do have a lovely weekend, everyone. Bye bye.